If you click this video away, then please tell me what the reason for it was, so that I can improve. Otherwise, hi, welcome. I am trying to learn medicine, today arteritis, and after we've done it, we're going to do stretching. And if you participate in the stretching, then it's better at your own risk. And we're talking about internal anatomy, the blood system, and diseases, and this is no medical advice, and I'm just reading it and trying to understand it. If I remember correctly, that is the second part which we're doing to arteritis. So that means we're going now over the text, trying to understand it and to gather the informations together and to learn them, so that we're able to making from memory a presentation out of arteritis. And the first way, I don't know how it's pronounced. Now we're having next to it arthritis. That is TH written, arthritis. So that would say that is arthritis. So I'm going to pronounce that now arteritis. Arteritis. An uncommon illness in which an artery or arteries is or are inflamed. Okay, the arteries are inflamed. Arteritis may occur in small arteries, such as in the fingers, or larger arteries, such as the temporal artery on the side of the head. Okay, we're going to just say inflammation of the arteries. We know, maybe we added, it can be smaller ones in the fingers or bigger ones at the side of the head. Temporal artery. I don't know what it is. Symptoms. Pain in the region of the artery, and an artery near the surface of the body will be tender. Okay, pain in the region of the artery and also tenderness where the artery is at the surface of the body. Duration. The symptoms are usually relieved quickly with proper treatment, but treatment may need to be continued for months or even longer to maintain relief. Causes. Usually unknown. Sometimes arthritis is associated with other diseases, for example, rheumatoid arthritis. Okay, we're going to say the causes are unknown in this book from the 70s, maybe most known, but it is sometimes associated with rheumatoid arthritis. We had pain in the region and also tenderness in the region of the affected artery, which can be technically all. It can be smaller ones in the fingers or the temporal artery at the side of the head, and it is inflammation of arteries, and it is arteritis. Complications. If untreated, the artery may become thrombosed. Okay, it can get serious. Maybe we're going to mention it. When you consult the doctor, if there is pain with tenderness in a particular area that persists for longer than 12 hours and has no obvious cause. Now, this is no medical advice, and the video we're doing is no medical advice, so we don't want to save it, but if we do it, it would be if there is for a bit longer pain or tenderness in some area. What the doctor might do. Look for the underlying cause of inflammation and treat with anti-inflammatory drugs. You're going to mention that there are anti-inflammatory drugs. Outlook with treatment, the outlook for arteritis is good. Okay. And if these prescribed by a doctor, prescribed and properly checked through, anti-inflammatory drugs are prescribed, then arteritis should have a good outcome. I think we have it all together. Okay, I have a second camera just next to the other one, and I'm going to start it now, and then I'll try to set it. Arteritis, that is inflammation of an artery. It can be a small artery in the fingers or the bigger one, the temporal artery at the side of the head. The symptoms are pain in the region and also a bit tenderness. And there are anti-inflammatory drugs against it, and if they are checked so that it is actually arteritis, and then probably the anti-inflammatory drugs, then the outlook is good and it should come to a quick relief. The cause is unknown in this book from the 70s. It is a bit associated with rheumatoid arthritis. That is according to Keith Hodgkin's Family Medical Advisor on the page 79, but this is no medical advice. Where's the camera? That was the medicine part. If you're here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the stretching, then it's already out. Having the feet standing together. And now we're opening with one foot and the other one. The heels and the heels, and so on. Toes, toes, heels, heels, so on. As far as you can go. And then back again. In again. Always one at a time, but this time stay down with the head, so go to the knees. Stay down. Legs a bit wider apart, and breathe in and lift the shoulders up. Breathe out and go to the side. Again, in and up. Out over to the other side. In and up. Out and down. Breathe again in. And out, and one hand slides down the leg, the other shoulder stays down. Breathe again in. And out, take one arm over. Breathe in and out the rib cage. And again out, back into the middle. Breathe again in. And out, the other hand slides down the leg, the other shoulder stays down. Now down. Breathe in. And out, one arm over. Breathe in and out the rib cage. And breathe out back into the middle. Have the feet standing together. Breathe in and lift the arms up. And breathe out, one hand down. Breathe in and reach. And breathe again out. Breathe in and reach high. And breathe out the other hand down. Breathe in and reach. And again out. Both down. Legs again shoulder width wide apart. And we're doing forward shoulder circles. And now backwards. Go in front, up, back, and down. Again in front, up, back, and down. Now breathe in and lift the shoulders up. And breathe out and let them again fall down. In and up. Out and down. Breathe in, lift the arms up. And reach always with one hand high up. Pretend to take an apple hanging high on an apple branch. Pretend to turn a little bit around and then pretend to lift it up. Now, legs wide apart. Arms up to the letter T. Breathe again in. And breathe out and shift over to one side, just with the upper part of the body. Again in. And breathe again out and go over to the other side. Again in. And out, lean onto the knees. Breathe again in. And out, one arm in front. In and back. Hold the other one in front. In and back. And out, and we're hanging down. Breathe again in. And breathe out, go over to the leg. Breathe again in. And out over to the other leg. Breathe again in. And out back into the middle. And now close the feet, but keep on hanging down. Breathe again in. And out. Again in. And out, come slowly with the rope back up and bend it with backwards, shoulder down. The toes are pointing to the outside. We are having an ulnar length space between our heels, and we're breathing up, breathing in, and lifting the arms up. And breathe out and sink down and place the elbows against the insides of the knees. Breathe again in and straighten up. And breathe out and come with the back up. Breathe again in. And out again down. Breathe in and straighten up. And breathe out and come slowly in one straight line upwards. Now have a good standing leg. Place the heel of a mobile leg on top of the knee of a standing leg. Breathe again in. And if you can do it without to injure yourself, breathe out and sink down. Up and change the leg. Heel on top of the knee, breathe in. And out and sink down. Up again. Legs wide apart, and we're ending. Breathe again in and cut down. Then breathe out. Again in. Out. Again in. Up. Out. Again in. Out. Now breathe in and close the legs. And breathe again out. That was the stretching. I thank you very much, and until next time.